The topic of this video will be monitoring regulatory requirements. As an overview and introduction, we'll be looking at the regulatory triad and trying to give some real-world examples of following the rules that actually exist, with an emphasis on how to identify what those rules are and actually document them factually. As a preamble, it's important to understand that all of the things that go into this process are related to the basics of supervision or performance management, where there are 6 components that every employee must be able to have in order to succeed. And those 6 are knowing what to accomplish, knowing how to accomplish it, having access to the tools to accomplish it, being motivated to succeed, taking responsibility for their own success, and recognizing success when it occurs. Failure in any one of these 6 aspects decreases the likelihood of a positive worker outcome, in other words, a chance for them to be successful. If something is not working, it will be necessary to identify which of these 6 factors are not being successfully addressed by you as a manager or by the worker in order to be successful. Also realize that this is a component of staff development, and that staff development has a 6-step cycle that includes self-assessment of the individual, looking at specific job tools, reflection, trying to understand where they are in terms of their performance with personal, meaningful, and honest reflection, a gap analysis, which is a reflection on what's the difference between where they are and where they would like to be, as assessed by the individual, the development of a plan that is typically on an organization's specific form, to assess their progress with regular review and revision, and then documentation of the individual steps and the recycling of the plan. Having said that, let's look at something called the regulatory triad. The regulatory triad is a hierarchy of systems that affect us and impose upon us requirements for the manner in which we practice. There are legal, legislative, and practice act issues. There are contractual and civil issues, and there are professional standards and organizational standards that affect us. Looking at those in a hierarchy, the first is the Practice Act or legal and regulatory requirements. These are things that are put in place by law and includes our Practice Act. It may also include federal law. It may include other things that are legislative or administratively regulated by organizations who have the power of law. Obviously, these are very powerful requirements and must be followed in all cases. The implications of not following can be significant penalties, and we won't get into those in the course of this discussion, but those penalties could include monetary penalties or actually loss of license or imprisonment. The second level are contractual agreements, and these are often taken into account when we sign provider agreements, for example, with Medicare or Blue Cross or other insurance companies, and they are contracts that say, here are our responsibilities to another entity. They are civil agreements, and they also detail what are the responsibilities of the other party to us. In terms of insurance, it typically consists primarily of we will follow their rules, and in exchange they will pay us for the services we provide. There are always many, many, many more clauses that are involved, and we will be looking at the analysis of a insurance contract in one of the other videos. But in addition to the regulatory and legislative issues of Practice Act, etc., the second layer is contractual agreements, which are civil agreements that we have voluntarily entered into. The last, and some would say the most important regulatory requirements or requirements that are imposed upon us for how we practice are those that we set upon ourselves, the professional standards. These are also, again, voluntarily entered into. And they are specific to each discipline. They are specific to, in some cases, geographical issues. But they are the standards that we as a profession impose upon ourselves. They may also include standards that are put in place by organizations that may or may not be more restrictive than any of the above. Now, obviously, it's important to note that if there are conflicts in the requirements of each of these three stages, typically the one that is the most restrictive is the one that is what we would need to follow. So the more restrictive requirements typically trump less restrictive requirements. As an example, under some insurances throughout the country, contractual agreements, civil arrangements for reimbursement may include payment for direct access physical therapy. Practicing here in Michigan, as I do, we do not have full unencumbered direct access at this point, as of 2014 spring. So we are still encumbered by our state licensure law that says that we will require a referral from a specific list of other practitioners to allow physical therapy interventions to occur. Even though contractually we've agreed with insurance companies that they would pay, there will always be a clause in the civil agreements that say all the other state and local laws must be followed in our provider agreements. So that's an example of the regulatory hierarchy. Now, as we look at this, those are the things that define what are the rules by which we must practice. And one of the questions that comes up is how do we know those? There's tons of rules. They sometimes conflict. There's tons of requirements, and there's significant liability if not followed. I will often talk to therapists around the country and even here in my own local area, and they'll say, I'm happy to follow the rules. I just don't know how to know what they are. And in a management situation, as managers and leaders, that's a real challenge for us. So we're going to start to look at some of the issues that are related to how do we help staff practice by the rules. One of the first things we want to do is try to develop a structured and organized manner in which to look at this issue. And it's something that I will call just for the purposes of discussion, something like a regulatory grid, a requirement grid, or a standards grid. And going forward from here, we'll look at 4 specific issues. We'll look at the problems with doing this. We'll look at the process that was used by one specific organization as an example. We'll also look at some of the results and some of the challenges that were involved. So here's the problem. With all these rules, we need to be accountable. That's part of being a professional. We have a requirement to follow these rules, and ignorance is never a good defense. So we also have to know the rules. And these are rules that are sometimes quite complex, often will conflict even on a specific patient situation, and they may be changing on a regular basis. So we need to have a way to stay current. And we really are talking about compliance with the rules of the profession, the rules that affect our profession. To do that, I think we have to look at this as being evidence-based, where we go back to core documents such as practice acts, such as regulatory directives, local coverage decisions, provider agreements, other things that in essence encumber us to follow a certain set of rules. And those core documents are critical and provide the evidence. Additionally, there are all kinds of urban myths about things that may have in the past been true about some of these rules, or in some cases never were true, that exist out there. And oftentimes we'll hear from therapists, well, I was told by a previous boss XYZ, and XYZ just wasn't even close to being true. So one of the key questions that every staff member and every manager should ask is, how do we know this, and what is the core source for this information? We're going to look at an example of a process that was put in place. And this is certainly not the only process, but this is one that I think has worked quite well. Not perfectly, but has worked quite well. An organization that developed a task force within their organization to address these issues. And as an example, here is the charge that was given to the task force: to create a resource that identifies the regulatory demands on our practice in a manner that can be accessed and understood by treating therapists in the field. Regulatory facts should reference core documents, reference an effective period, include summary statements of their meaning, be updatable, and be accessible 24/7. The construct of the project was, first of all, and I'll point out that this was an organization that I work with called In-Home Rehab, and is located in Michigan but has divisions in multiple states throughout the country, and is structured as a physical therapist or occupational therapist in private practice model under Medicare and a variety of other things locally. But these are independent therapists in a large group practice. The construct was to first identify what we called agencies that regulate our practice as PTIPs and OTIPs. Those agencies could be governmental, they could be payers, they could be profession related. That's the hierarchy we just talked about. Secondly, they need to identify regulatory issues that should be known by treating therapists in order to comply with the requirements. And we'll talk about these issues and agencies in just a second. They should third create a mechanism to research, collect data, references, and summations of the issues that are identified by the agencies. And we decided to limit our geographic scope first to Michigan and then the rest of the states that in-home rehab was in, as we needed to work on a bite-size group first. Then to create a mechanism to review and update these issues and agencies in a timely manner and assign ongoing accountability for update and maintenance of this information. Okay, identify agencies that regulate our practice. Identify regulatory issues that should be known by treating therapists. Let's talk about issues and agencies. Agencies that we identified were organizations or entities that affect our practice and somehow promulgate rules. This was the initial list that we came up with. That certainly was Medicare, the state of Michigan itself, the American Physical Therapy Association, the American Occupational Therapy Association, Blue Cross Blue Shield of Michigan, a variety of Medicare Advantage or Medicare, and for Blue Cross, Medicare Advantage is Medicare Plus Blue in Michigan. Commercial insurances, TRICARE, Blue Care Network, which is an HMO, HAP PPO, the Align Network, Humana, ARP, United Healthcare, Aetna, Cigna, and Priority Health. These are entities that affect us from a regulatory standpoint and also the larger payers that we dealt with, or the payers that we dealt with more frequently. Some of the issues that each of these agencies probably have some rules about included things related to the use of a prescription or referral process to therapy, how they define a diagnosis, what's required for evaluations and prior authorizations, what types of individuals can refer to us. As an example, Medicare does not allow dentists to refer Medicare beneficiaries to physical therapy for example, TMJ. Actually, they allow it, they just won't pay for it when it happens. In the state of Michigan, dentists are an acceptable referral source, so the referral type is specific to the agency that's involved. We also want to talk about what's required, what are the requirements for supervising assistants when they're in play, how do they define medical necessity and the requirements for coverage of care. What do they require for progress reports and plans of care and daily notes and discharge reports? We wanted to make sure we had access to a provider manual when it was a payer that had a provider manual. If there was certification by referring physicians or other entities, what were those requirements? Obviously, for Medicare, we had to address the therapy cap and the threshold for manual medical review. If there's a provider agreement, we want to have access to that. If there's a billing manual, and if they publish any coverage criteria. So those are just examples. We also knew that the number of agencies and issues would probably expand as we started to get into this project. The results. This is an ongoing project. It probably will never, ever be completely finished. And one of the pieces that we did was we built this regulatory grid or requirement grid, or accountability grid, but we typically call it regulatory grid, right into our management information system, with the idea being that we wanted to be able to get one click to answer the question of what are the issues for this particular patient, what are the agencies that affect this patient, and then most importantly, what are the rules that are in play that we have to follow if we're going to treat these patients in a manner that is compliant with those rules. Let's give you an example. Here's a patient, Mrs. Jones. She's a Medicare primary patient. Blue Cross Blue Shield of Michigan is secondary. She lives in Michigan, and she's being seen by a physical therapist. So she's a PT patient. The agencies we identified are the state of Michigan, Medicare, Blue Cross, and the APTA. In addition to that, for all of our patients, we also identify our own internal rules and any specific guidelines that we have in terms of policies and procedures. Some examples of the issues that we had with Mrs. Jones: who can write a referral and sign a plan of care? Are there differences between what Medicare says and Blue Cross says and the state of Michigan says? When do we have to reevaluate, and what are the requirements for doing a reevaluation? Is a discharge summary required? What's required in each type of note? An initial evaluation, a daily documentation, a progress report, a discharge summary, all the different kinds of notes. And if a physical therapist assistant is involved, what's required for supervision? Each one of those answers could be different for Medicare versus Blue Cross versus the state of Michigan versus the professional standards of the APTA or our internal organizational standards. As you can see from this example, there are potentially lots of challenges to keep this all straight. Some of the challenges that we looked at and that we identified as we were going through this is that we really were struggling to find any existing models out in the field. We actually did a survey of organizations, significant organizations throughout the country, and we really didn't come up with a good model. The most common response we got when we told people what we were trying to do and asked them if they had anything like this was, "No, we don't have anything, and when you get done, can we look at yours?" That was almost 100% of our organizations. The closest that anyone came to having a legitimate model was to hire an outside consultant to function as a compliance officer. And we just did not think that that was an adequate response. Another challenge was communicating the existence of this resource to staff and keeping it in their front of mind process. We also found a challenge in identifying additional issues and agencies. They kept popping up. Oh, here's one more, here's one more. Here's something else that somebody has a question about. And it became much easier to identify additional issues and agencies than it was to actually research them. We also found a challenge in implementing a regular review of this for updates, and we actually built into the process how frequently, with the tickler file, how frequently does each of these issues and agencies need to be reviewed? Our default was quarterly. Some of them were not quite as frequent. Some of them were more frequent. And some of them are just ad hoc. For example, with the frequent changes that occur, for example, in Medicare, when Congress legislatively does certain things, we had to have some that were just ad hoc and really pay attention to constantly. Another challenge was to integrate this into our management information system in a meaningful manner. And that's really a challenge and will be unique to each organization. In some cases, that may be almost impossible depending on how much control you have over your management information system. A significant challenge for almost anything like this would always be the training of staff for its appropriate use, and then making sure that it is used appropriately and that it actually is used. So one of the things that we found was that making it easy was a good idea, but it didn't assure that people would actually use it. Our actions were to describe a structure and system to identify and monitor regulatory requirements for your practice and to recognize current and potential future trends that will affect reimbursement and practice. That's what we were trying to do, and we constantly went back and took a look at this and the charge to the task force to make sure that that was occurring. We're certainly not complete on this. We're not finished. We continue to work almost a year into it on Michigan, and we are moving to other states at this point. We are expanding it to occupational therapy, which is a small component of our practice, but not nothing. And we wanted to share with you some of the thoughts that we had on this. Now, obviously, there are other things that have to happen, but the key question that has to be asked is, if your staff is willing to follow the rules by which you get paid in practice, how do you give them an opportunity to actually know what those rules are? And that's a significant challenge. That's the information that I wanted to share with you on monitoring regulatory requirements. The challenge for you is to now develop a system for your organization that will work given the environment in which your organization lives. It may be similar to what we've given as an example. It may be different. That's the challenge that faces you. I hope it's been helpful. Again, this is Peter Kovacek wishing you all the best.